The topic that I chose to study is called necrotizing fasciitis. The name itself means decaying infection of the fascia, which is the soft tissue that forms part of the connective tissue system that runs through the body. This is a very rare infection that occurs when bacteria enter the body through a simple break in the skin, such as from a cut, a burn, or even an insect bite. Once the bacteria enter the body, they begin to spread rapidly through the fascia. They also produce endotoxins and exotoxins, which restricts blood and oxygen flow to the tissue. This causes extreme amounts of tissue loss and degradation. The endotoxins and exotoxins also prevent enzymes from breaking down and digesting dead tissue. The infection may spread to the bloodstream and infect the body's vital organs, leading to organ failure and death. Symptoms of necrotizing fasciitis are often confusing and overlooked. They develop extremely quickly and spread at an alarming rate. Early symptoms include redness, swelling, severe pain, and fevers. Later symptoms include pus, blisters, black spots on the skin, lesions, changes in skin color, dizziness, nausea, and diarrhea. To diagnose necrotizing fasciitis, doctors will need to biopsy the tissue, take blood samples, or use imaging such as an MRI. Treatment must be started as soon as possible because the infection spreads so quickly. It may only take a couple of hours for substantial amounts of tissue to die. Patients will be sent to the ICU and will immediately receive antibiotic therapy. Patients will be evaluated for sepsis, and doctors may need to perform emergency surgery to remove the infected tissue. If the infection is severe, amputation may be necessary. Even with prompt treatment, 1 in 3 cases of necrotizing fasciitis leads to death. Necrotizing fasciitis is a very rare disease. That is, in the U.S., there are only about 700 to 1,200 cases per year. If left untreated for too long, prognosis of necrotizing fasciitis is very poor. Because it spreads so quickly and the primary symptoms are often overlooked, this infection often leads to organ failure and death. If treated quickly, though, chances of recovery increase greatly. If doctors can isolate and remove the infected tissue, the patient has a much better chance of survival. I chose to study this infection because a friend of mine this winter was diagnosed with necrotizing fasciitis. He had a cut on his hand, and about 3 hours later it was throbbing, and someone told him to go to the hospital, and the doctor said if he went 2 hours later he could have died. So I think it is a very fascinating infection and also very scary. But yeah, I hope you enjoyed.